Next, a children's home in Merseyside has been issued with compliance notices after Ofsted raised serious concerns about the safety and protection of the young people living there. Inspectors found widespread failings in care standards, management oversight and safeguarding, including staff not recording incidents where children were restrained. The home, operated by Jupiter Child Care Services, was rated inadequate across all areas, despite 2 children being in residence during the visit. Ofsted says significant shortfalls in responding to allegations of harm and delays in sharing safeguarding information have put children at risk. A Labour MP has been suspended after Marcus Campbell Savers voted against the government's plan to tax inherited farmland above £1 million. Representing Penrith and Solway, he said he'd promised constituents he would protect long-standing reliefs and warned the change risks breaking up family farms. The government argues the revised threshold still shields smaller estates, while critics within Labour say ministers have lost support in rural areas. Around 30 Labour MPs are believed to have abstained, reflecting continued unease across rural seats nationwide this week. The government's response to the COVID inquiry has already cost more than £100 million, on top of the inquiry's own spending of nearly £200 million. Inquiry sources say departments have at times been defensive and slow to release documents, pointing to last year's High Court clash over access to Boris Johnson's messages. Health Secretary Wes Streeting has criticised the British Medical Association as the dispute continues over mandatory online GP appointment booking across England. He says most surgeries are embracing the system, with new figures showing more people now contact practices online than by phone. The BMA warns the patient's safety could be undermined because urgent requests are not properly triaged and some practices are overwhelmed. Ministers say the approach will end the 8 o'clock scramble and have provided extra funding alongside recruiting more GPs this year to help capacity. Patients groups say clearer guidance is essential so people understand online booking is for non-urgent needs, warning that confusion about emergency care routes can place pressure on overstretched surgeries. They want better signposting and consistent opening hours to ensure the system works safely for all users.